You mentioned the elderly population. What are the implications for this demographic in Ontario if these cuts go through?
Well, what we observe is that the patient population that bears the brunt of cutbacks is actually the elderly, and not just the patients, but their families, oftentimes people live quite healthy lives, and only as they get much older do they start to experience significant health problems. That's when they present at the hospital looking for help. And oftentimes they're sent home, they're sent away, or if they're admitted, they're pushed out much too quickly. And at the CUPE, you've got a readmission rate of almost 10%, which means 1/10 of the people that are sent home have to come back. They were never fixed, but in order to meet the funding targets, they're pushed out. So what we observe for the elderly is that they have difficulty getting in. There's incredible pressure to get out. They have difficulty accessing home care in the amount that they need it. They have difficulty getting into long-term care. In long-term care, they have difficulty getting a quality of care that meets their needs. This is a group that actually suffers the most from the healthcare cuts.
And one last question for you, Michael. In terms of the recommendations that the research that the OCHU and the CUPE have done, can you tell us a little bit about what the specific recommendations are?
Yes. Well, first of all, we discourage the government from engaging in more hospital restructuring, healthcare restructuring. The Auditor General said that the last restructuring efforts cost an extra $3.2 billion. This is money, obviously, we don't have and which could be spent on care. Privatization should be discouraged. The private-public partnership hospitals have cost $8 billion more than if they'd been publicly operated. The electronic health records was a fiasco. The Orange Air ambulance was a disaster. We're discouraging the government from going down that road. We're asking the government to step up and face the fact that we need to provide the supports in the community in terms of mental health and addictions, in terms of increased support for people at home. There needs to be increased staffing in long-term care, and we need to be funding the hospitals at their real level, which is more like 5.2% a year, rather than the cuts in real terms, which we've experienced over the last 12 years of the previous government.